These villages are in total isolation. One wall of this valley are the Ganesh Himals, the Himalayan mountains. And the other side of that would be Tibet. These hills are as tough climbing as the mountains are. And this is a very, very difficult terrain. It's brutal living here. People here were considered cavemen, or what they call people of the jungle, and were looked down upon. A lot of these folks have absolutely nothing. So many children were dying in these villages. So no government support was here, or services were here, no healthcare, no nothing. And nobody wanted to come up the hill to help them. I tried not to look at children's faces. Sometimes the kids are too far gone. You can't save them.
People weren't living very long. In rural Nepal, 1 in 5 kids were dying by age 5, and 1 in 10 women were dying in childbirth, and the life expectancy was very low. The government had promised medicines for so long, and yet where they live, if you get a fever one day, you could be dead. You just could die up there.
They know for sure what their basic needs are. What is next for them, or what would help them? It's kind of lost for them because they're living day to day. But then you ask them a lot, saying, okay, what do you think would help you in your life? And based on that, we've organized our efforts to help them with that. We target 3 main programs: healthcare, education, and income. It's almost about 30 projects that we're doing at a time. And for each of them, there's a committee, a subcommittee, so that the people are involved, so that they make the decisions as stakeholders, actually get to say what they want. Yeah, the mission is very simple. It's just help people help themselves. It's a jargon that most social organizations speak about, but we'd like to actually do it, not just talk about it. We call them medical treks. We invite international volunteers. We've had almost 600 doctors come into our program. Many of them come multiple times. Some come almost every year. It's as huge as an Everest expedition. There's already an advanced team of 50 porters who will be taking almost 30 basketful of medicines and some of the heavier equipments in advance. And then there'll be 50 others who will be with us, carrying the food to the tents, to the tables and the chairs, to get this whole team of people over 2 high mountain passes, through snow and ice and what have you, to enter this valley we call the Akukhola Valley in central Nepal. We have to drive about 10 hours, this winding dirt trail, to get ourselves up to the first camp. And from there onwards, it's walking over passes through the Himalayas. It's not easy. There's only 2 ways in Nepal, up and down, and very rough terrain. And this is not like a regular trek route where you have tea houses and trails have been fixed. It goes over these 2 high passes in the middle of really nowhere. Every step is, you have to be careful where you put your foot down. And also the ledges, they're steep slopes, several thousand feet drops. And if you fall off, that's it. To reach this village area called Tipling, Sherpung, Lapa, and Charlang.
Generally, a trek will last 4 to 5 medical days at these specific villages. It's a good week overall to 2 weeks to get in and out. During these treks, we'll see anywhere between 800 and 1,000 patients. And that's only one aspect of the trek. One of the most important parts of the treks, of these medical treks, is actually doing the educating of the healthcare workers here. And that's one thing we spend a lot of time on.
Most important things to us, because we are providing a health service for these people, Today, my duty is with Dr. Ashika.
If he told you he has difficulty to start...
She teaches more knowledge and skill to me as like a different disease, and then how to diagnosis of the problem or disease, and how to treatment, prevention of the disease or other problems.
You know, it was almost like having a resident work with me in 24 hours or whenever that was. I'm not going to be there anymore, it's him. So it's a matter of him being able to take as much away from what I'm able to provide for him.
The stress he must be under 24/7 here, being the only provider in Tipling, called any and all times of the day, medical conditions that would make us pause in the United States, then he just tackles them and goes right on. He's fearless.
We want that attachment to not be attached to the tooth anymore, like that, okay? Then you can do the other. What we're going to do today, a lot of is her do a lot of the work and me be here to help her and get her through and talk a little bit about what's the right tools to use and how to go about it.
I have learned lots of things. Doing easily way for the extraction of teeth, I learned how to give the analgesia.
What I love about her is that she's so eager to learn the new instruments and how to use them. She's not afraid. Every time I say, do you want to try something, she always says yes. And it's really fun to see her, the 2 days we've been working on her, how each day she's getting better and better and more confident.
Working with all of these healthcare providers, they get it. That's awesome to see.
So healthcare was, I would say, the hub of the program. And that's a good start. But with that comes literacy classes. So if you don't understand about health and hygiene, and that the connection between them, then it's all lost. We said, okay, the wives are the people we really need to work on, the mothers.
They're very receptive, and they're very concerned for the children, for the family, and they're like the main people in the villages.
Help them with toilet building and about latrines and about clean water, and that's how we stepped into literacy classes.
When we started the latrine project, the women groups started getting very excited about it.
HSC donate only materials. We implement them. They build themselves. HSC donated tin roof, 40 roof, and steel, and cement, fan, pipe, all of material like need. When we bought from city, we estimate 25,000 rupees, $350.
उहाँहरूको पनि त्यही हो, अघि भने जस्तै स्थानीय स्तरमा पाउने ढुङ्गा गिटी ल्याउने काम उहाँहरूले गर्नुहुन्छ। अहिले उहाँहरू सुरुवात गर्दै हुनुहुन्छ। यो सुरुवात गर्न 9 दिनको समय लाग्छ। 9 दिनपछि गाह्रो लाउने, त्यसपछि गाह्रो लाउने, त्यो प्यानहरू स्ल्याबहरू मिलाउने, अनि त्यहाँबाट ढोका हाल्ने, अनि त्यसपछि कम्तीमा 1 महिना भित्रमा 1 देखि 1.5 महिनासम्ममा यो घर तयारी हुन्छ।
Women empowerment program is one step more than the literacy program. If we encourage the women in developing works like education and vaccination, about making toilets, about the social awareness, domestic violence, the society really develop. The lifestyle, the living standard will be better.
भन्ने गर्छ नि हैन, महिला शिक्षित त परिवारै शिक्षित भन्ने अब मान्छे हुन त सरसफाइ आफ्नो व्यक्तिगत चाहिँ गरिरहेको हुन्छ, तैपनि तिनीहरूले बाहिरी कुराहरू चाहिँ खासै जानिरहेको हुँदैन। अनि त्यसले गर्दा सरसफाइदेखि लिएर उनीहरूको चाहिँ कुनै मिटिङहरुमा इन्भल्भ हुने कुरा, त्यस्तै आफ्नो व्यक्तिगत सरसफाइ, अनि त्यस्तै यो जस्तो हाम्रो इम्युनाइजेसनको कुरा, हेल्पको कुराहरू हुन्छ नि, तिनीहरूमा समेत एकदम सक्रिय भयो के देखियो मैले। त्यो चाहिँ एकदम प्रभावकारी देखिएको थियो, एकदमै चेन्ज भएको छ, आकाश र पातालकै फरक भइरहेछ। बच्चाहरूको स्थितिमा चाहिँ के छ भन्दाखेरि अब पहिला चाहिँ के भन्थ्यो भने अब जस्तो असर साउन आउँछ नि हैन, त्यतिखेर एकदम बढ्ने स्थिति थियो। अब यहाँको गाउँको मान्छेहरूले कुरा गर्छन्, पहिला त महिनामा चाहिँ 10-15 जना बच्चाहरू बोकेर चाहिँ गाड्न जानु पर्थ्यो भने अहिले त वर्षमा एउटा बच्चा मर्दैन भन्ने कुराहरू उनीहरू आफै गर्छ के। हामीले आमा मरेको स्थिति चाहिँ भेटिरहेको छैन, एकदम घटिसकेको छ।
रगत मासी पर्ने, झाडा बगान लाग्ने त्यसो कारणले मरेको थियो अहिले बच्चाहरू पनि मरेको छैन पराबुढीलाई पनि उपचार गरिरहेछ
Over a period of time, we tried 20 or 30 projects. This failed and that failed, and we did pretty miserably. We said, okay, income generation. How can we help them make a little more money? So there's more money at home, means more food, and then it's going to help the kids directly in their health. And eventually we got partners and friends who said, okay, maybe this will work. And then we went into environmental handicrafts, and then we got into goat raising and a bunch of other stuff.
अनि पहिला भन्दा धेरै भयो सहयोग भयो यसले यता उता खर्चलाई भयो 3 वर्ष लाग्यो नि सर स्वेटर ढाकी ठुलो चेयर अनि झोला सबै त्यहाँबाट सिकाएको हो
In such place, blacksmiths are called untouchable caste. Even the Tamang don't allow to Kami enter their homes. Himalayan HealthCare encouraged Kami for the education. We provided them sponsorship.
Every time we found somebody who has the brains or the talent or the interest, and we just took those people in and we started training them. So right now we have about 8 teachers trained and teaching in the villages. Bahadur Vishwakarma is a teacher now in Shartung. He is the first teacher from a blacksmith family. We're very proud of him.
म 2 वर्ष हिमालयन हेल्थ केयर को विद्यार्थी बने मैले चाहिँ 1 क्लास देखि 8 क्लास सम्म पढाउँछु र जातमा मैले जति पढेको काई पनि छैन जसमा चाहिँ यो गाउँको यो दलितहरुको एउटा उदाहरणीय पक्ष भएको छ म पढ्दाखेरि खाली म मात्रै हुन्थ्यो पढ्न अहिले सबैले पढाउनु पर्छ पढ्न पर्छ भन्ने धारणा चाहिँ एउटा उदाहरण म बनेको छ
उहाँले चाहिँ हाम्रो लागि मात्र नभएर चाहिँ समाजको लागि नै राम्रो काम गर्नुहुन्छ
मलाई चाहिँ सबभन्दा राम्रो पार्ट चाहिँ पढाउनु हैन किनभने मैले पढाएको विद्यार्थीहरु हैन म भन्दा पनि माथिल्लो सिडीमा गइसक्या छ मलाई सबभन्दा खुसी त्यो नै लाग्छ हैन
You know, the lives of the Nepalese and providing health care in these rural areas is tough enough to begin with. It was just compounded manyfold with challenges once the Maoist insurrection and the guerrilla warfare started back in 1996 and lasted to 2006. Between 16 and 20,000, that's the estimate, died from this guerrilla war. And unfortunately, many of those were innocent men and women and children. It affected not only the rural Nepalese, but also us as an organization. We had staff members that were kidnapped, held ransom. We did get them back, but we were extorted to get them back. The Maoists, as well as the government forces, put pressure on us to not treat the other warring side, telling us that we couldn't do what we were here to do, and that was to offer health care for all. HHC managed to build a hospital in Ilam, overcoming many obstacles that a war would throw at any organization.
That's a project that is dear to our hearts because of all the efforts and also because of the time it was started when civil war was so huge and so devastating in Nepal. We can't allow a civil war to beat us down. And we said, let's just go ahead and do this. Hundreds and hundreds of people showed up to actually participate as stakeholders. It was very touching and heartening to see that people were so involved and so enthusiastic in spite of the civil war. April of 2004, we were able to launch it. It was the beacon of hope for the people then in the midst of all this battle and people dying and that even out of all this we have to continue this. There's hope here, and that's what we persisted with.
Through the darkest moments of this war, we stuck to what we did best, and that was give health care, education, and income generation opportunities to these villages. How Himalayan HealthCare navigated these difficult times has made me realize, really what a special organization Himalayan HealthCare is. We're resilient, we're responsive, And it's one of my more proud moments of being part of Himalayan HealthCare, seeing how we negotiated this line we had to walk.
I always believe that NGOs are not about empire building. NGOs are facilitators and catalysts, and they fill gaps. Times have changed. Since 2006, after the end of the Civil War, new governments have come in, and all the different political parties have come together to write our new constitution. Healthcare and education seems to be something that the government is promising and starting to deliver a little more. As the villages and Nepal is evolving and changing, we have to change accordingly. Fill in those slots and make up for those deficits so that the people have long-term benefits. We're looking at individual entrepreneurs and see how we can hone their skills and help them write out business plans. And we're going to do that more and more, especially with women. If we train young people to take over a lot of the projects that we do, and they will continue with the work, and that will enhance or create better and bigger things beyond what we have started.
I've been in Tippling, where this started in 1992. The leaders of that village community are young people in their 20s who've actually been around and grown up in the environment of opportunity provided by Himalayan HealthCare. So now you have a whole set of people who are leading the village and the communities because of the influence of Himalayan HealthCare. So I've really seen firsthand the kind of change that has taken place.
One reason I keep coming back to this organization, and I'm so committed to it, is the work it does. And at the end of the day, the results that we get.
Up top, up top.
We really made a difference in the lives of the Nepalese in helping them help themselves.
You know, every time we come back, there is things that you can see that they've done and improvements they've made, and you know, still there's a whole lot more to do.
Lot of NGO and INGO in Nepal, but they did not succeed because they have no sustainability works. They did not train the local people. They did not share skill in local level.
So we looked at his creatinine.
But HSC does it. So HSC is a very successful organization.
We can use it in this case or not?
I think Anil Parajuli is the heart and soul of Himalayan HealthCare. He founded it. He's been working day in and day out ever since 1992. He's really got passion for serving the people of Nepal.
He has good vision, and he's a kind-hearted man, and he loved the people. He's coming and going, and several times, many times, more than 200 times he walked through this way.
He has done a good job of developing a vision to develop healthcare for villages who have never seen anything like it. And good stuff too, not imperialistic culture invasion, but simple stuff. Hygiene, toilets, the stuff that really saves lives.
Anil is universally very well respected and liked in all these villages. You see with the blacksmiths, the commies, that he's educating them where they hadn't been educated before. With women, he's set up women empowerment programs in the villages. This educational component has had direct effect on their healthcare. We've been able to lower some of the infant mortality rates in some of these villages from 200 per thousand down to about 20 per thousand.
The start of it,
He knows sort of the next step in the process, has a lot of great foresight in terms of working with the people and what his next steps are going to be. So this is something that other organizations, I think, should really look to emulate, because it's something that could tremendously change the landscape for care in many impoverished rural areas elsewhere in the world.
Himalayan HealthCare is proud of what it's been able to do for the people for all these years. But we're also very humbled by all our work.
So I don't see any signs of a secondary infection. That's much better.
There's such a thing as altruism. There are people who just like to do things for others.
if this comes back, then he should probably...
It's the heart more than anything.
Kathmandu or something.
You just have that passion to go help people. We're not doing any rocket science. I've not created any of these things in my head lately. But the passion and the emotion, yes, definitely. That's key ingredient in doing all this. Because without that, it's not going to work.